So what is hip impingement? Hip impingement is also referred to as FAI, or femoroacetabular impingement. And it is a clinical condition wherein the ball of the hip joint comes into contact with the socket. And that can happen through several ways. So sometimes there's extra bone growth on the ball or changes during the development of the ball itself that leads to a relative prominence or flat spot on the ball. It's a little bit like having a square peg in a round hole. Okay, so that's one way. Another way is for there to be extra bone growth on the socket side so that it covers the ball more so than it normally would. And the most common way is a little bit of both. Regardless of the underlying cause, when impingement does occur, there's consequences. There is a soft tissue structure here known as a labrum, and it can be pinched and tolerate that to some extent. But with enough force or with enough repetitions, that labrum can tear, and that will often result in pain. Symptoms from this are typically felt as pain in the groin area or the front of the hip region, although it can be felt in other areas. And although symptoms may begin as groin pain, they can evolve to involve other structures around the hip joint as one's mechanics begin to falter as a result of having this symptom. So that's essentially what hip impingement is. There's a variety of treatments, some of which are non-surgical, some of which ultimately require surgery. And so I encourage you to reach out to your healthcare provider if you have any further questions. Thanks.